Hello there, everybody. This is Dr. Jack Belitz, and welcome to the Ask Dr. Jack Show.
Hello, everybody. I'm Aaliyah.
And together, we have a lot of fun doing this show. What's our topic for today?
Today we're talking about back pain and an interesting article that came out about how medical doctors have been treating back pain wrong.
And it's really awesome because you don't really normally hear medical doctors telling or saying that back pain is being treated wrong by the medical community. But in this case, this article does exactly that, and it's really, really awesome. Basically, there's this Professor Bachbinder. Say that 3 times twice. Anyway, did a paper called A Call to Action. And basically, what they were saying is that evidence-based studies show that when you have back pain, bed rest and staying away from work is not the best way to handle it. For the most part, staying active is the best way. And as you know, that is not the way most medical doctors want to treat this.
Right. They often recommend rest. And what's the saying? You know, a body in motion stays in motion.
Yes, yes. And so anyway, and another thing they point out is that all of these major tests are being done on these people, and all they're doing, or a big part of what they're doing is causing major concern by the poor patient. You know, they're finding things that they're concerned about, and it's causing all kinds of things like, opioid addiction and steroid use and all this other stuff, based upon these radiological findings. And so there was this procedure, or a suggestion on procedures done in this country or province of Victoria. I'm not exactly sure where this is, but it's called the Victorian Work Cover Authority. And basically what they were looking at was the significant medical costs that were associated with back pain and how they could reduce them. And so in this series of papers, they told the doctors of this community that there's way too many tests being done, and they're not only not helpful, but they're exposing people to extra radiation through CTs and X-rays, and they were creating unnecessary concerns. And so what happened was this campaign showed a significant positive results in the way the community viewed the way, how doctors were handling it. However, the medical doctors still did not have their minds changed about what was the proper way to do it. And so after 10 years of struggling, it was basically just gotten rid of. And that's kind of too bad, because I think way too many things are addressed with bed rest, and it's just not. Now, here's the thing, I get it. Medical doctors don't want to see their patients in pain. They just don't. And they don't want to be giving them painkillers all the time. If they had another way of treating, back pain that was successful, they might do a little bit better job of this. And
well, they do. They just choose not to use it.
Well,
chiropractic is successful constantly with back pain.
And wouldn't it be nice if they recognize that? But anyway, so if you're dealing with back pain, or if you know somebody that is, like this video, share this with the friends that might be dealing with this, because this is information that they need to know. If they're getting advice from their medical doctor, which is basically saying, here, take some pain meds and rest, we've got some really major stuff from the medical community right here in this paper saying that's not the best way to do it. And maybe we need to look at something else. And we've had some tremendous success, so I would love to help you out. Other chiropractors are out there all over the place. They could help you out. I mean, there's some amazing things that can be done rather than just sitting there waiting for this back pain to get better on its own, when rarely does it happen. So, anyway.
That's right. So
stay healthy, Omaha.